Welcome to today's episode, where we delve into a critical health issue, acute kidney injury, or AKI. AKI represents a sudden decline in kidney function, crucial for filtering waste from the blood. Let's unpack the causes of AKI, which are diverse and can severely impact kidney health. Starting with prerenal causes, these are due to insufficient blood flow reaching the kidneys. Hypovolemia, for example, involves low blood volume from dehydration, bleeding, or severe fluid losses, such as those from diarrhea. Another prerenal factor is Hepatorenal Syndrome, typically seen in advanced liver disease, where renal blood flow decreases without direct damage to the kidney tissues. Next, let's talk about renal causes affecting blood flow within the kidneys. Cardiorenal syndrome occurs when heart failure leads to kidney congestion and decreased blood outflow. Similarly, renal vein thrombosis involves a clot that blocks blood from exiting the kidneys, causing damage and congestion. Moving to postrenal causes, these occur when urine flow is obstructed. This can happen with a bladder obstruction from an enlarged prostate or neurogenic bladder, or from tumor compression in the pelvic area. Another obstructive condition is retroperitoneal fibrosis, a rare issue where excessive fibrous tissue blocks structures like the ureters. For intrarenal causes, starting with small vessel disease, we see conditions like thrombotic microangiopathy, which includes diseases like TTP and HUS that form small clots within the kidneys. Another is atheroembolic renal disease, where cholesterol particles from atherosclerotic plaques block renal vessels. Glomerular pathology involves immune-mediated damage within the kidneys. Diseases such as lupus nephritis deposit immune complexes in the glomeruli, causing inflammation. Pouty immune disease like GPA and anti-GBM disease, where antibodies attack the kidney's filtering units, also fall under this category. Tubulointerstitial damage includes conditions like acute tubular necrosis, where tubular cells die due to lack of oxygen or toxins, and acute interstitial nephritis, often triggered by allergic reactions to medications. Tubular obstruction includes conditions like crystal deposition, where substances like oxalate from ethylene glycol poisoning can form crystals and obstruct the tubules, and cast nephropathy, where abnormal proteins, such as those seen in multiple myeloma, can form casts that block the tubules. Now that we've covered the various causes and mechanisms of acute kidney injury, let's test your understanding with a USMLE-style question. A 65-year-old man with a history of diabetes and hypertension is admitted to the hospital with complaints of decreased urine output and generalized swelling. He recently underwent coronary artery bypass graft surgery. His medications include metoprolol, lisinopril, and furosemide. Laboratory tests reveal elevated blood urea, nitrogen, and creatinine levels. Which of the following is the most likely cause of his acute kidney injury? A. Acute tubular necrosis. B. Hepatorenal syndrome. C. Postrenal obstruction. D. Prerenal azotemia. Think about the mechanisms we discussed and how his medical history and symptoms might influence your answer. Please leave your response in the comments section below. We're eager to see your thoughts and explanations. Don't forget to subscribe to OneUSMLE and turn on notifications to stay updated with our latest discussions and exam preparation tips. Thank you for tuning in, and we look forward to engaging with you in the comments.